In the heart of the Free State, every call is a life interrupted.
Emergency medical service, Magna speaking. How can I help you?
It begins with a voice, a mother,
Hello. Kikupa ambulance.
a farmer,
I need an ambulance quickly, please.
a child.
Hello, is there the ambulance?
Equipment is checked. Routes are calculated. We don't just see a patient, we see a person in crisis.
Control on mobile. Patient stabilized.
Transport is more than movement. It's continuous care in motion.
Hasta arrived.
The handover isn't just paperwork, it's a clinical bridge. It is not easy. Long hours, emotional strain. These are our heroes. From fleet managers to paramedics. Every second counts. Every life matters. Rapid response, patient dignity, and safety. This program is proudly brought to you by the Free State Department of Health.
One of the keynote speeches that we heard this morning was from Sipho Towa from the Free State Emergency Medical Services. Sipho, thank you so much for coming from the stage into the room here to talk a bit about the work that you're doing within the medical services there in the Free State. It was a very, very powerful presentation you gave, a reminder that geospatial information and the way we use information can save lives. Tell us a bit about what you've told the colleagues this morning.
Thank you very much. When you look at the history of emergency medical services, things were done manually, and then we would rely on asking a person that can you send someone to go and wait for us at a certain corner. And in terms of your data or history and analyzing your patterns as well, one could not, you had to go through a lot of papers and all that. So with the introduction of technology and taking the emergency medical services communication to an electronic platform, it became important that to get a system which can map you and take you where the incidents are. And also the system will be able to plot you where are your hotspots. And you can also see when are your busy days and then what time do you get a peak of your calls. So we then approached Esri and said, let us get a system where we'll be able to place a resource via auto vehicle tracking or any type of device. And from that, after you've plotted your incident, you'll be able to can see which of your resources is the closest to the incident. That helps in improving your response times. So you don't have to look for a car that is very far, but you can immediately say, this is the closest car. You'll get also an estimate of travel time to where the incident is. So it's what we've been working on through the years. We've been working on the system from 2014. Yeah, so it's 11 years that we've been working on the system.
A decade's worth of implementing, fine-tuning and learning the lessons through the implementation, right?
That's correct. We're sitting now at 2.7 million worth of data of incidents that we've dealt with in those past 11 years.
Wow, so approaching 3 million incidents. I'm assuming that the ability then to start looking at the data analysis, as you say, where things happen, when they happen, what are whether it's gender issues, whether it's a whole range of aspects, you can start to drill down into that and start having prediction almost around what you expect is coming.
And pre-plan as well for your emergencies and to know where your hotspots. An example would be recently, I think in June, through the system, we were able to pick up a trend in one of the districts in Putswa, where we were having a spike in terms of respiratory-related incidents for the 5 years and younger. So then we pulled the data, and then we could see it in a certain area in the district, and then we gave it to our communicable diseases center, and they started doing investigation. And then they could also pick up there's a certain virus that is affecting the below 5 years old.
And you were able then to put an emergency plan in place that could remedy that.
That's correct. There was an outreach that came out there from the
Fantastic.
department and with that data that we pulled for them.
What I think really I enjoyed about your presentation was the point that you were making is that you are an emergency practitioner. Your job is to be out there serving people, serving communities, and making sure that we are kept safe. You're not a GIS fundi. You're not somebody who's out there looking at but this ability to start joining the work of operational services like yourself with the data-driven analysis side is a really exciting part of it. I think that's what people really appreciate this morning. Have you had any feedback in relation to that since your prelo this morning?
There's quite a number of people that actually approached me, and I think what I always do, when you get to my office, you'll find there's always papers, reports, and all that. I try to sit down, analyze the trends, and that helps me as well to make sure that when we get resources, before we advertise post, we do the analysis and see where is actually where is the need. For example, that's why one can easily know that the busiest district we have is in town of Tsenyan. Though the population, when you look at, one would expect the metro to be busier, but the metro is well resourced in terms of health facilities. So the Eastern Free State, which is more rural, is vulnerable. So we then serving a lot of community there because we also, when you look at the data as well, the population that we're serving, which is the uninsured population, is 87%. So there's only 13% that are actually insured, and most of them are in the metro. So the burden on us as public service, we need to concentrate where there are no other alternatives for the community.
One of the biggest challenges that all services, whether it's municipal, provincial, national, has is in relation to informal settlements and the ability to reach into those spaces, navigate the streets, etc. How are you being able, if at all, in using this data and the technology that's available to enhance your delivery in the informal settlements?
It reminds me of back in the days when I was still operational. We were called to one of the informal settlements in Kroonstad then. And then as we got to the pickup point, the guide was on a bicycle. So he said we should follow him. And then we come with an ambulance behind him, we followed him. And then he went into a passage. So we stood there with an ambulance, and then he continued halfway through the passage. When he looked back, he said, oh, the ambulance can't come through the passage, he had to come back, go around the street. So when you look at now what we're doing is we're going to introduce a citizen engagement app. What the citizen engagement app is going to allow us to do is to get location or coordinates of where the caller is. So then that will immediately do away with the escorts. We won't be saying to the guy, go and wait for us at a certain corner, which will then route us directly to where they are. So that will improve also our response time, and it also will then lessen the burden of putting the community at risk. Because at times it's at night.
Sure.
So you ask them to go and wait for you. When you dispatch, we'll tell them, when we dispatch, we'll send you a message or we'll phone you and say, go and wait for us there. But also, the person in 5 minutes, anything can happen.
Of course.
Yeah, so those are the things that I'm looking forward to when we launch the citizen engagement app, that we'll be doing away with sending people to the corners. Yeah, because with the informal settlements, some of them you'll find there's numbers that they give and all that.
Some are well ordered, some are well, but it's more when it becomes very random and early days.
And the biggest challenge we always face is when it's towards elections. you know what happens? Then there'll be new
invasions, increasing densification of
That's-
existing ones.
That's
etc.
correct.
I
So
can imagine.
those are the challenges that we've been facing through the years.
I'd like to ask you a question which I think is a tougher question in terms of the bigger picture for emergency services across the country. It seems at times your officers and your responders are being targeted by communities in certain areas, are being attacked. How can this data start to assist you in again, you've talked about identifying hotspots in terms of certain elements, but also I'm guessing it can help you in terms of preparedness for certain areas in terms of the volatility that exists.
I must say we're still lacking the Free State. We've had a very, very isolated number of cases as such. But when you look at your provinces like Western Cape,
for sure.
your Gauteng, they even have areas where they call it a no-go area.
No-go, which is unbelievable within the context of the work you do.
And then you look at it, then you expect law enforcement to maybe give escort to them. But they also have their own pressures.
Yeah.
They also have their own pressures where they have to satisfy their needs of carrying out law enforcement. So the important part is, I always say, it starts with the community. Because these people that are doing these attacks and what, they are staying out there with the community. So we plead with the community, help to keep our paramedics safe.
You talked about when you were back in the operations days. Sipho, do you miss it? Now that you're, I'm guessing, in the office behind the desk, do you miss the days when you're out there?
Yeah, no, there are times where one still wears the green uniform, the overalls, and then go out there.
Boots on the ground.
Yeah, no, it will always be there. It's embedded in one's veins.
Well, again, to you and the team in the Free State, thank you for the services that you render to the communities. Thanks for being here and for being one of the most inspiring speakers that we've seen. Really appreciate the practical dimension, the life-saving dimensions that you put on the show. And keep doing what you're doing. In 2 years' time, I want to hear more about where you've done, what you've done, and where you're going.
Definitely. Because this data as well is a data that one sit with the planning section of the department that we want to build a new clinic or we want to build a new hospital. And with the information that we have, we can actually say, let's maybe have a trauma center here. You don't have to have a fully fledged clinic, because in this area we are vulnerable of maybe motor vehicle accidents, gunshot cases or assaults. So a trauma center will then make sense to build it there. So this is what the power of having data, this is what we do. So I take this data, I give it to the executive, and then I advocate having facts.
There you go, you heard it from the horse's mouth. The man who's out there in the field, the man who's trying to set the strategy, the power of data is leading to the decision making. More strength to you and the team. Thank you for spending time with me this morning. Look after yourself and enjoy the rest of the day. See you tonight.
Thank you very much. We'll definitely be there. We'll denim and dine.
Denim and dine indeed. All the best to you, Sipho. Thanks for your time.
Thank you very much.